Locate the scapula spine.
My favorite place to go here is to go right behind the scapula, up towards the spine. There's a nice pocket of fat there. If you remember from our rabbit anatomy, that brown fat, well, guess what? Most of the dogs have some fat right there too, even on thin dogs.
Incision approximately 7 to 8 centimeters.
I honestly don't even make it that big. I just make it smaller. We only need, 5 to 20 grams of fat. It doesn't take a real large incision. See a nice pocket of fat right there. Very, very easy to get at that fat. The neat thing is we found that the stem cells live around all these vessels. So historically, when we'd get into fat and would start bleeding, we were all pretty upset, but now that's a good thing. We're probably going to get lots of stem cells. So don't be afraid. Just cut that fat out of there, get it into the jar, and then we can stop the hemorrhage afterwards. This is easier than a spay.
Stage 3, digestion of the adipose tissue. Collect the adipose tissue into the sterile yellow cut 70ml container in the kit. Finally cut the tissue with sterile scissors in the yellow cut container until the pieces of adipose are between 2 to 4 millimeters in size.
Notice that she placed the lid of that cup down. You don't want to place it up. You don't want it collecting bacteria from the air. We're going to have some room air exposure in this process. The whole process, there's about 10 minutes of room air exposure, and that's why we use antibiotics in the wash. We have less exposure during this process than we have during the surgery itself. And I know a lot of surgeons out there have done joints and lots of surgeries where we've had a lot more time exposed to the air than 10 minutes.
Add 2 mL of
We're starting the pre-digestion process. We're mixing up the fat and we're adding solutions to start the pre-digestion so we can incubate it.
Mix the contents well by inverting the tube and place in the oscillator.
We're not shaking these real hard. We're just creating a vortex and we're mixing it up real well. We want it to digest.
The hot water bath has been pre-warmed.
Which is normal body temperature, 98.6 degrees. You can check it with a digital thermometer periodically.
Every 10 to 15 minutes and invert or shake the tube and place back into the water bath as the contents will settle down in the tube.
That's going to help separate out the stem cells and the stromal vascular fraction.
For 10 minutes. You should now see 3 layers in the tube. The top yellow or clear layer, the middle layer, a white fibrous layer, and the bottom layer, which is red and contains
That's the gold mine, that cell pellet at the bottom and that red fluid.
Place the sterile mixing cannula firmly on the end of a 20 ml syringe and slide the end of the cannula to the bottom of the
I pull up a little bit of air in that syringe, so when I go through that white connective tissue, I push that air out so I don't get any connective tissue down there.
Up in the syringe. Expel all the contents of the syringe into a new 50 ml tube.
You just want to make sure that large spout is on the bottom. There's a little white
The red layer containing
plug on the other side. You want to make sure that white plug is above that spout. That's just in case it's come apart and you have to put it back together. You want it to be the right way. Otherwise, when you suction it, it'll go right into your pump.
Remove the supernatant using a larger transfer pipette without disturbing the cell pellet at the bottom, leaving approximately 1 to 3 mL. Transfer all the solution containing the cells to the 15 ml tube using a small transfer pipette.
This whole process is a very easy step-by-step process.
Centrifuge the adipose tissue at 2,300 RPM for 10 minutes.
After we did the first few, we asked our technicians what was hard about this, and every single time the technician said nothing.
Using a
It's just
small
doing it once or
transfer
twice.
pipette,
It's easy.
Add the partially dissolved PRP fraction into the cell pellet using the same.
I bring it up to
transfer
2
pipette
mLs.
until
I like the
volume in tube
PRP. I
is
like
1
all the
to
growth
2
factors.
Minimum
They
1 ml.
provide many, many
The volume
benefits
will
to the
depend
stem
on the
cells and the
number
stromal
of joints
vascular
required to
fraction.
be injected.
So I always bring it up to 2.0 mLs, and then what I'm not going to use in the joints, I give the rest intravenously. I put it into a bag of sterile saline solution. I usually minimize that bag down to 100 mLs or maybe 50 mLs if it's a real small dog.
Place the
And I don't
into
waste
the
them. I give them
diode
intravenously.
activation light and switch on for 20 minutes. Locate the patella, the tibial crest. and
Make
the
sure when you're
patella
pulling them out of the vial that you're using a sterile syringe and sterile technique. It's very easy. They're encapsulated. You can get those in packages, so they're sterile. Very easy to do.
Inject the stem cells into the stifle joint.
Here we're treating the stifle joint. It's very easy. I don't withdraw synovial fluid. I don't need to know that I'm in the joint. That's your decision. You get used to this. You know when you've walked it into the joint. Pretty straightforward technique. Very, very easy. Literally, the joint injections take about 5 minutes if I'm doing 2 or 3, maybe 4. We try to prep them when we're collecting the fat. We know which joints we're going to treat, and we try to prep them ahead of time.